Howdy, everybody. Welcome to session 5. This is the 5th session of 6 for the 25x5 Symposium to Reduce Documentation Burden on U.S. Clinicians by 75% by 2025. As a reminder, this is a program that was funded by the National Library of Medicine. We have a leadership group that is led by Sarah Collins-Rossetti, and I'm co-lead. We've got a wonderful steering committee that includes representation from diverse individuals from across the country. And we also have support from FAMIA, Columbia, Vanderbilt, a number of other organizations. We have a website. That website is linked at the bottom. It includes a number of resources, including our ongoing agenda, number of background readings, access to our listserv, archived videos, slide decks, and shortly the chat transcript from the very, very great active chats that folks have been contributing over the course of these sessions. As a reminder, we have several principles of engagement, things that we want to keep in mind as we develop our plan for reducing documentation burden. These are on the slide. They include leveraging technology and existing data inputs where appropriate. That is, for example, reducing redocumentation of information already captured during other intake processes. There's a goal not to erode clinical care standards as measured across numerous axes, such as quality, safety, value, efficiency, and access. There's a goal to maximize clarity of proposed rules to minimize misinterpretation by health systems and providers. As many of us are acutely aware, different health systems interpret existing regulations in different ways, which leads to confusion and overwork. And last, we want to avoid wholesale shifting of unnecessary work from one clinician to another. We'd rather seek to eliminate unnecessary documentation altogether. Our requests for you today, please, and we've said this before, but we really are emphasizing it today to support our breakout work. Please put your full name in Zoom. You can scroll over the picture of me, or if you prefer, Ross, who's better looking than me, to see how that's done. Please use the chat functionality when we are in our large group. When we're in our breakout sessions, the chat may not be as effective, but while we're in the large group, please use your please use the chat for discussion and questions. If you're not talking while in the large group, please mute yourself. While you're in your breakout groups today, feel free not to. Use your gallery view so you can see the people around you. If you tweet, please tweet both in real time, that means right now, and in between sessions. The hashtag is #25x5. All ideas are worth contributing in the chat, in your questions, in your breakouts. And everybody's contributions will be archived and made available to the community. One last thing, Craig, make sure I get this right. If you've not previously, today we're doing breakouts, if you've not previously given your preference for breakout, just indicate that in the chat right now. Put your name in the chat and say, I need a breakout assignment, and Craig will take right care of you.
If you didn't fill out the survey that was discussed after session 4, if you filled out the survey, you're in a breakout. If you didn't fill out the survey, just note that in the chat, and then I'm going to put people in the remainder of the breakout rooms. Thank you.
Thank you. So again, this is session 5 out of 6. Next week is the final session. Today, as I'll describe in a moment, we've got a keynote and then we're going to do breakout sessions. And the goal of the breakout sessions is really to begin the final work of identifying actions that will lead to our goals of reducing documentation. This will be both based on our prior sessions input and the framework we have for burnout that we've shared before that includes different contributors to burnout, such as regulatory issues and self-imposed issues and so on. So today's agenda, we are very fortunate that Dr. Zach Kahani has agreed to join us and give us a keynote discussion about where might we go from here. We'll then drop in the breakout sections, which will be 60 minutes. You are all assigned or will be assigned to breakouts focusing on one of these 6 areas. They are listed here: reimbursement, regulatory quality, usability, interoperability, and self-imposed. Your goal for these breakouts, and Peter's going to talk a little bit more about this in a few moments, this week and next. This week is really to dig deep on what the problem is, what the contributors are, what is trying to be solved by those contributors to reimbursement-related burnout, for example. And then begin to work on solutions, ideas, ways to fix this so that we can achieve our goal of reducing documentation burden by 75% by 5 years from now. And you want to think about short-term, medium-term, and long-term actions. Following this, there will be a very short breakout. We've got a lot of groups, and so each group will have a short breakout so that we can finish on time, and then we'll pick up the work next week. I hope you can all join us.